Have you ever wondered if a simple garden flower could help ease one of modern life's most common pains? In herbal medicine, some of the strongest allies arrive in the humblest packages. Meet Feverfew, cheerful to look at, quietly potent within. For centuries, folks admired it without realizing the secrets in its leaves and blossoms. Its story stretches across generations, ancient healers to modern herbalists, all pointing to its remarkable ability to bring comfort and relief. Imagine a time before pharmacies. People relied on the green world for well-being. They learned to identify plants, understand their properties, and prepare them safely. Feverfew became one of those trusted green allies. Its name, from Latin febrifugia, literally means fever reducer. Ancestors saw it as a plant that cooled the body's inner fire. Native to southeastern Europe, it traveled widely, settling in gardens and apothecaries. Its reputation grew by real-life experience, not just proclamations. A grandmother shared, "Chew a leaf to head off a headache." A village healer brewed tea for aches. Today, ancient wisdom meets modern science to ask, what makes Feverfew work? And equally important, how do we use it safely and effectively? This video is your friendly guide to Feverfew, benefits, safety, and practical uses. We'll explore how it helps with migraines, inflammation, digestion, and skin, then cover who should avoid it. Quick note, this is educational only, not medical advice. If you enjoy natural health content, like, subscribe, and share to help others. Let's rediscover this old friend and see how its simple gifts still fit modern life. First, what exactly is Feverfew, and how do you spot it? Feverfew, Tanacetum parthenium, is a perennial in the daisy family, returning year after year. It shares kinship with daisies, sunflowers, chamomile, and echinacea. Look for a button-like yellow center surrounded by delicate white petals. The plant forms bushy clumps about 1 to 2 feet tall. Leaves are yellowish-green, feathery, deeply divided. Crush one and you'll notice a strong, somewhat bitter aroma. Through history, it earned nicknames like bachelor's buttons and the medieval aspirin. Dioscorides wrote about it for hot swellings, an early nod to its cooling, soothing nature. Traditionally used for fevers, arthritis, and digestion long before modern pain relievers. In the 1970s, the wife of a Welsh doctor chewed a few leaves daily, and her lifelong migraines stopped. That story sparked rigorous interest and a wave of clinical research, a bridge from tradition to trials, validating what herbalists observed for centuries. Feverfew became a standout candidate for migraine prevention. So how does it help with migraines? Key compounds called parthenolides are thought to drive many of Feverfew's benefits. They may help inhibit the release of serotonin and prostaglandins involved in migraine cascades. Result: calmer, more stable blood vessels, which may stop an attack before it starts. Multiple trials, including a Cochrane review, reported fewer migraine days per month versus placebo. For many, that means fewer painful days and more life back. Important, Feverfew is preventive, not a fast painkiller. Consistency over months matters. Beyond migraines, Feverfew is a gentle but effective anti-inflammatory. Chronic inflammation fuels joint pain, stiffness, and everyday discomfort. Parthenolides help downregulate inflammatory pathways, supporting symptom management. Not a cure, but a supportive ally for osteoarthritis and rheumatoid discomfort. Studies show decreases in inflammatory markers, echoing traditional use. Topically, purified Feverfew extracts can reduce redness and calm irritation. Key tip: topical formulas often remove parthenolide to minimize sensitivity risk. Research suggests antioxidant and photoprotective benefits against UV-induced redness. Traditional herbalism also used Feverfew to ease menstrual cramps. By reducing prostaglandin activity, it may lessen contraction intensity and pain. Some find benefit taking it in the days leading up to and during the cycle. Feverfew is a bitters traditionally prime digestion. Bitters cue saliva, stomach acid, and enzymes, supporting comfort after meals. That can reduce bloat and post-meal heaviness and support nutrient absorption. A small pre-meal tea may gently awaken a sluggish appetite. Herbs often have several talents. Feverfew supports connected systems head to gut. Seeing the whole plant helps us appreciate its many gifts. Before you try Feverfew, let's cover essential safety. Feverfew is generally safe short-term for most adults, but be aware of side effects. Chewing fresh leaves can cause mouth sores, so-called post-Feverfew syndrome. It may include mouth soreness, tongue ulcers, and inflamed lips. Most people prefer capsules or tea over raw leaves. Other side effects are usually mild and digestive, often resolving as your body adapts. Start low, increase slowly, and pause if symptoms persist. Major caution: Feverfew can affect platelets and act as a blood thinner. Do not combine with anticoagulants or antiplatelets like warfarin, clopidogrel, or daily aspirin. Mixing them can increase bleeding and bruising risk. Allergy note: if you're allergic to ragweed, chrysanthemums, marigolds, or daisies, you may react to Feverfew. Reactions can include rash, itching, or other allergy symptoms. Avoid if allergic. Avoid Feverfew if pregnant, breastfeeding, or under 18. Safety is not established, and risks exist. Feverfew is traditionally a menagogue and may trigger uterine contractions. Scheduled for surgery? Stop Feverfew at least 2 weeks beforehand. If you take blood thinners or have a bleeding disorder, talk with your doctor or pharmacist first. Now, how to use Feverfew wisely and how to choose quality products. Reminder: everything here is educational only. Always consult a qualified professional for your situation. Most evidence supports capsules or tablets of dried leaf. Look for standardized parthenolide content. Common preventive range: 100–300 milligrams per day, often at least 0.2% parthenolide, per your clinician's guidance. Tea: 1 teaspoon dried herb in 8-ounce boiling water. Cover, steep 10–15 minutes, then strain. It's very bitter. Soften with a little honey, peppermint, or lemon balm. Traditional leaf chewing exists, but due to mouth sores, it's generally not recommended today. Topicals can soothe redness. Choose purified Feverfew extracts to minimize sensitivity. Choose reputable brands that follow GMP. What's on the label matches the bottle. Verify botanical name, dose per capsule, and standardized parthenolide. Shop natural food stores, trusted herbal companies, and well-reviewed apothecaries. Brands that grow or closely source their herbs can offer excellent quality. Feverfew is easy to grow in sunny, well-drained spots, and it self-seeds readily. Harvest leaves and flowers as buds open. Constituents are thought to peak. Dry the herb for tea through the year. Connect with the plant from garden to cup. Store in airtight glass. Cool, dark, and dry. Light, heat, and moisture degrade potency. Properly stored, dried Feverfew keeps about 1–2 years. Follow labels for commercial products, from migraine prevention to easing inflammation, digestion, and skin. Feverfew is versatile when used wisely. Use it safely. No side effects, interactions, and who should avoid it. This video is educational only. Talk to your doctor or qualified herbal professional first. If this helped, like, subscribe, and share for more natural health insights.